In this video, I'm going to show you how to fix inner knee pain in seconds. Stay tuned. Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. In this video, we're going to go over easy exercises that can offer both quick and long-lasting relief for inner knee pain. This includes pains from general muscle tightness to more severe conditions such as meniscus injuries to Anserine bursitis. And to make this easy, I'm going to break the video up into two separate parts. In the first part, we're going to focus on getting quick relief. But if you're looking for more long-lasting relief, possibly getting rid of it for good, definitely check out that second part. As a bonus, all of the exercises can be done at home and you may find give quick knee pain relief even within 30 seconds. So with that being said, let's get started and fix inner knee pain right now for good. Let's start by getting some quick inner knee pain relief, and we're going to do this by releasing a lot of soft tissue and muscle tightness. This one can give relief within seconds. As a note, if you do have some massage oil or lotion, anything that's designed to be put on the skin, grab it and pretty much coat everything below and above the knee. It will make this exercise much more comfortable. But if you don't have any, no big deal, just go very lightly with it. So let's start off by focusing on an overlooked area that causes a lot of issues on the inner or medial portion of the knee. It's called the Anserine. It's an area where a lot of tendons meet, and when this becomes inflamed, it can cause what is known as Anserine bursitis. So to find this area and see if this is possibly going on, if you pretty much go right below the knee joint, which is roughly about right here, and start to press on the inner part of your shin, if you start to find a lot of tenderness over this area, maybe even sharp pain as you press in there, it becomes more likely that that bursa is irritated. So here's a way to get some quick pain relief. What I would do is go below that area, kind of trace down on your shin, and go right towards the middle of your calf. And then from there, what I'd like to do is just take a thumb and do nice long strokes upward like this, applying enough pressure in there where it's going to cause a good self-massage, but not causing any discomfort. So keep doing this over and over again until you finally feel that tightness or that pain is starting to go away. You can also attack the muscle fibers at different angles. So instead of going up with it, go down like this, kind of like a parallel motion, but explore the whole area and target any spot that you feel needs it a little bit more. And I would recommend doing this pretty much over the whole calf on both sides right here, avoiding the shin bone, on pretty much all soft tissue below the knee, because everything connects right here and we want to make sure everything is nice and loose. So after we are done focusing on the Anserine region, what I like to do is turn my attention to the inner part of the thigh right here over the adductor muscles. When these muscles get tight, you can imagine it's going to cause a lot of pain right here at the medial or inner part of the knee. So what I would do with this one is take both thumbs right here and start to do a rolling motion like this on the inner part of your thigh towards your groin. Again, finding any spot that you feel is a little bit more tight and achy and repeating over that area until all tightness has been released. From there, what I like to do is then focus a little bit more on the quadriceps, because a lot of tendons go through here that attach at the knee, especially the kneecap, that can cause pain right here on the inner part of the knee. So again, what I'm going to do is just this nice rolling motion with my thumbs over all of that soft tissue. With this one, you pretty much want to go over the top part of your thigh right here on the inner part again, top, off to the other side, and then below the knee. Usually what I do for the bottom part to make it easy is just grab my fingers just like this and then repeat, just massaging this whole area. Another method that you can do that's a little bit deeper than the rolling thumb motion like this is a pinching motion like this. I always kind of think of it as like pinching dough. So at this point, what I'm doing is just really trying to dig into those muscle fibers just a little bit more, pinching at them, grabbing in there, and just finding any spot that needs it just a little bit more. But go through that whole area, and any spot again feels like it needs more attention. Keep repeating this until everything is nice and loose. In this part, we're going to focus more on strengthening muscles and tendons that help support the inner knee. This one is going to be really good for not only quick, but long-lasting relief. I'm going to go over two different exercises. Start with the first one. It's a little bit easier, and when you feel ready, progress into the second one. This first one is called a step up. We can use a couple different things for this one. You can use a step up board, just like this. I'll leave a link in this video's comments section if you would like to get one, but this can easily be done at a bottom stair or step. So let's start off by just stepping up on that board or the step just like this. Whatever side that you're having knee pain, let's say it's my right side, we're going to keep that foot flat and just simply step off and lower our other foot downward like this, kind of mimicking going downstairs. The key with this exercise though is we want to have it nice and stable. So when we go down, we don't want our knee buckling in or out. We want it in line with our toes. It's all about building strength and, more importantly, stability to take stress off those muscles and tendons and hopefully get some good pain relief. So you want to do this one nice and slowly for about 10 to 15 repetitions. And also, this should not cause pain. All of these movements should be pain-free. So don't progress into the next one until this is a pain-free motion. But once you feel ready, like this is not challenging enough, what you can start to do at that point is use weights, something like a dumbbell, a kettlebell, even a milk jug. Just put it against your chest just like this and then repeat. You're going to notice that it challenges the muscles a little bit more and you're going to gain some more strength. But I like to do this for roughly 10 to 15 repetitions. And if it feels like you have a little bit more energy, you can always throw in another set or two. So to make this one even more challenging and engage more muscles, this is what you can do. Instead of keeping this back foot flat during this exercise, as you lower this foot down, lift your heel up like this and place all of your body weight onto the ball of your foot. You're going to notice that the calf muscles really engage with this one. I feel it a lot on the back of my knee also. So give that one a try when you are ready. To take this one to the next level, what we can do is, instead of going straight ahead like this, is go off to our side. We call this a lateral step up. This one is going to engage those muscles on the inner part of our thigh even more. So with this one, again, we want to keep our knee nice and straight, and we're just going to step off to the side. Again, the side that has pain is going to be on that board. And then you're just going to step up just like this. Give this one a try for about 10 to 15 repetitions. Just nice and slow. You can also use weights with this one to make it more challenging. If you want to take this one to the next level, what we can do is engage the glute medius just a little bit more. The glute medius is a big stabilizer of the hip and the pelvis. So if we can take stress off of this area, likewise, it will help our knee. So as you do this exercise, let's step down. On this bottom foot right here, we're going to raise our toes upward as much as we can, put all of our body weight onto our heel, and now step up. You're going to feel that glute off to the side of the hip really start to engage. So go through all of these motions and progress into them when you feel ready. So let's build off that first exercise by doing one that's a little bit more challenging. The great part about this one is it's going to help both lengthen and, more importantly, strengthen muscles and soft tissues around that inner knee. I call this one the all-in-one. We just need something like a sturdy chair, preferably one without wheels, but you can also use something like a desk or a wall. Let's start with very good upright posture. That means just having your back nice and straight, and you're going to put the painful side towards the chair or the wall. So in this case would be my left side. To get into position, we're going to start by placing all of our body weight onto the painful side's heel. So again, this is my left side. I am then going to tighten my core muscles. It's kind of like taking my belly button towards my spine to help support the spine, and then we're going to squeeze the glutes during this exercise. So I'm going to start off by just placing the other side's leg straight out in front of me like this, toes pointed forward. What I want to do with the painful side's knee is slightly bend it and making sure with this one to keep it in line with my toes. So make sure it doesn't buckle out or in. Another thing too is as we start to squat into this position, make sure not to go to the point of pain. Stop right before that. Through repetitions, what you're going to notice is you get more pain-free range of motion to be able to do this exercise. So definitely don't build into pain. But the movement is very straightforward. We're just going to slightly squat downward, taking our bottom down and slightly away to the point where we can touch our foot towards the floor. Treat this like a clock. So let's start straight ahead at noon. On the next repetition, we're going to go to 1 o'clock. We're going to work our way towards 3 o'clock and then go all the way back as much as you can. When you can't go any further, work your way back to 3 o'clock and then all the way to noon. The great part about this exercise is it's going to help identify certain positions and movements that need it a little bit more. So let's say as I do this at 3 o'clock, I just have a lot of tightness or it just feels really weak. At that point, that's your weak link and you want to throw more repetitions in. I like to roughly do this about 5 to 10 times at that point, but you're welcome to throw in as many sets as you like. But just really focus on the spots that need it just a little bit more. So to lengthen the muscles after this strengthening exercise, we're going to do what is known as a side lunge. This one can be done throughout the day, anytime that you need quick pain relief. Very, very easy. What I'm going to do is start with a little bit of a wide stance, a little bit more than hip width, and I'm going to put my hands together kind of like a prayer position and then put them towards my chest. Again, let's tighten our core muscles, squeeze our glutes. With this one, what you're going to do is whatever side that you're having pain, so let's say it's my left side, you're just going to step towards the other side and then lunge into it with your body weight, keeping this foot as flat as possible. The more that you go over, the more that you're going to feel a deep stretch in the inner part of your thigh. This one really helps hit the adductor muscles and you're going to feel it right there on the inner part of your knee. You want to hold this comfortably for 20 to 30 seconds and then you're just going to come back up like this and relax. And then repeat this one 3 to 5 times. And with each repetition, try to build into it just a little bit more. If the exercises helped, please support the channel by giving this video a like and maybe subscribing too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thanks for watching.